I'm Dr. David Morwood. I am a board-certified plastic surgeon, and this is Your Health radio and television program. Thanks very much for being with us. In this third and final segment today, we're going to do something a little bit unusual. I'm going to give a mini lecture. I'm going to discuss cleft palate, and I call this mini lecture Cookies, Coca-Cola, and Clefts. I just got back from South America operating on children, primarily with cleft lips and cleft palates, and I've been going on these trips for over 15 years. I was lucky enough to be the first surgeon who went with Rotoplas to a town in Chile called Antofagasta, and the founder of this Rotoplas program, Angelo Capozzi, went to another city, La Serena, and we operated separately for a week, and then we combined forces for a week and operated together. And over the years, I've noticed that going on these trips, pretty much everyone understands the repair of a cleft lip. I mean, it's obvious why we fix a cleft lip. Most people understand the cleft lip is a split in the lip is separated, and it's very obvious. And of course, the lip is a social tool. It's important to these children to grow up looking good and have a chance to appear normal. But it's rare, I find, that someone understands what the palate is or why we repair the palate. And that's what I'd like to discuss in the next few minutes. On this recent trip to Paleta, Colombia, I gave a short talk to our team of volunteers and medical workers, and we answered a lot of the frequently asked questions and what we're doing in the operating room with cleft palate. So to begin, as I said, the cleft lip's pretty obvious. It's a split in the lip that we can see, and our job in the operating room is to repair the cleft lip and realign what we call the Cupid's bow. That's the part of the lip that we can see that goes up and then down and up and down, and there's the philtral columns, those little lines that come down from the nose. And it's pretty straightforward in terms of understanding the concept. We want to close the cleft of the lip, reunite the muscle. We try to realign the oral side, of course, in the mouth, and the skin, so a child can grow up with a more normal appearance. Oftentimes, at the same time of doing a cleft lip repair, we'll adjust the nose or try to fix the nose, because with some of these more severe clefts, the cleft goes up into the nose, and the nose can actually be distorted as well. So they get what's called a tip rhinoplasty or a cleft lip nose deformity revision at the same time. Now, what about the cleft palate? First of all, the palate is the roof of the mouth. And there's two parts to the palate. The hard palate, which is what most people think of as the roof of the mouth. That's the bony structure that you can feel with your tongue. And then there's the soft palate, which is posterior or behind the hard palate. Now, if we think anatomically, the roof of the mouth, or the hard palate, or the palate, is actually the floor of the nose. So let's picture a split. Now, you can have a cleft or split in the hard palate only. You can have a split or cleft in the soft palate only, or they can be combined. You can have a split or non-union of both the hard palate and the soft palate. Now, oftentimes, we'll see children that have a cleft of the lip and of the palate. Now, they can go together. Or you can have just one or the other. You can have a cleft lip alone, or you can have a cleft palate alone, or they can be combined. Now, a few words about the cause. Why does a child have a cleft lip or palate? How do they come about? Well, what we know is that on day number 28 in utero, in the development of the embryo, development of the baby, day number 28 is the day when the facial segments are designed to fuse. The two maxillary segments come together, the two mandibular segments come together, and what's called the frontal nasal process rolls down from the area of the forehead and the nose, and that frontal nasal process is designed to fuse with the lateral maxillary segments coming together on day number 28. Now, keep in mind that on day number 28, most women don't even know they're pregnant. And so it's at that early stage in development where at even something going awry can result in a cleft. And we know some causes, for example, hypoxia. That's when oxygen tension gets low. Or phenidone, that's a medication or drug being on board. If there's phenidone on board, a baby can have a cleft lip or palate. Also, there's a lot of experimentation and work being done with folic acid. One of the theories is that there can be either folic acid deficiency, or even with mothers that get enough folic acid, there's a problem with the metabolism. In other words, the folic acid is not properly metabolized, and a cleft lip can result. Now, we do have good evidence that neural tube defects, such as spina bifida, etc., can be associated with a folic acid deficiency. And here in the United States, for any woman considering becoming pregnant, any woman of childbearing age, she's encouraged to take folic acid supplements. And we know that can have a beneficial effect towards lowering the incidence of neural tube defects, and possibly, it's not clear, but possibly folic acid can do the same thing. So again, in terms of the cleft palate developing, there are a number of ways. There's also a syndrome called Pierre-Robin, where a baby will have a very small jaw and a very large tongue and a cleft palate. The theory is that because the jaw doesn't grow forward and the tongue can't get out of the way, then the roof of the mouth can't fully fuse, and that results in a cleft palate. Now, why do we repair a cleft palate? As I said, most people understand why a cleft lip needs to be repaired. Most of these kids that we see are shunned. If they're not repaired, they're afraid to go to school. They can be social outcasts, etc. But what about the palate? Well, first of all, I want to do a little training exercise, and I want to teach the audience about the importance of repairing a cleft palate. Now, you've got to hang in there with me for just a moment. Now, I want everybody who's listening or watching this little mini lecture to do this little exercise. Now, if we start by making a sound that goes like ah, or if we make a sound like ooh, that's very different than if we make a sound like papa or dada or tango. Now, here comes the money move right here. If we make a sound like cookie or Coca-Cola, what we're doing is exercising velopharyngeal competence. Now, the reason why we went through that little exercise as we start to talk about why we repair a cleft palate is because the job of the soft palate is to act as a valve. And what it does is a little hammock or flutter valve, and when we speak and say certain words and make certain sounds like cookie or Coca-Cola, the job of the soft palate is to act like a flutter valve and go up and touch the back of the pharynx. In other words, it redirects the airflow between the nose and the mouth and acts as a type of flutter valve and kind of in some sense, a train station. It's the director of how the airflow goes, and it acts as a valve. So when we say cookie or Coca-Cola, that soft palate goes up and touches the back of the pharynx, and again, exercises velopharyngeal competence. Now, for a baby with a cleft palate or a split, even though the palate may elevate and go up and touch the pharynx, there is still the airflow that escapes through the mouth or escapes through the nose. And therefore, the big problem with cleft palate is the speech. The babies, as they become a little bit older, at about 9 months to 14 months, typically babies will try to imitate the people around them and start to make sounds. They can't say certain words and they can't make certain syllables, especially these words that we call plosives and fricatives. Those are words or sounds where it's vital or of vital importance where the palate, the soft palate or velum, touches the pharynx, and the baby needs to exercise velopharyngeal competence. If they're unable to do that, that's called velopharyngeal incompetence, or what we call VPI. So I hope that's clear. So the job of the soft palate primarily is to act as a flutter valve, touch the pharynx during certain sounds or during certain speech modes, and redirect the airflow. And that's also important why Speech pathologists are a vital part of the cleft palate team here in Europe and the United States, and why on every rotoplast trip to a developing country, we try to bring a speech pathologist, because in addition to repairing the palate, whether it's the hard palate or the soft palate, we try to get the kid back into training. We try to get the baby and the mother and the father into doing exercises, and you can actually exercise the palate to be stronger once it's repaired. That brings up an important point, that for timing, certainly here in the United States, we do our best to get every soft palate repaired before the age of, say, 9 or 10 months. That's because babies will try to make their first sounds and say their first words at about 9 months to 14 months. So again, the primary reason to repair the palate is for speech. However, what else goes on? Babies can't make a vacuum if they had that hole between the nose and the mouth. In other words, if they lack that roof of the mouth, which is essentially the floor of the nose, they can't make a vacuum and they can't suckle. And they're very slow feeders, and milk can come out their nose. They have a hard time swallowing. And of course, in developing countries where there may be a shortage of milk or formula, and if the baby takes a long time to eat, the mother may have a frustrating period of feeding them, and they tend to be of low weight when they see them, and they have a lot of trouble gaining weight. So speech and being slow eaters are two big reasons to repair the palate. Now, what else can happen? The eustachian tube, which connects the middle ear to the pharynx, opening up in a little hole, is cleared every time we swallow, especially when we swallow hard. Now, everybody's got the example of going up in an airplane or going up in a very high elevator fast, and you have to swallow and clear your ears. That's the eustachian tube being opened by that little vacuum and the little flutter valve. For babies with a cleft palate, they can't do that, so they get very frequent ear infections, and that's oftentimes why an ENT or ear surgeon is involved in the cleft palate team in parts of Asia, developed parts of Asia, in Europe and in the United States. Also, the typical nasopharyngeal flora, the bacteria, can be different. And you know, saliva just is not designed to be up into the nose. We're designed to have that roof of the mouth and the floor of the nose to separate the two. And so those are all reasons why it's very important to repair the cleft palate. Now, certainly cleft palate repairs we could talk about for hours, and I find it very rewarding to talk about this, and I think what we probably should do is conclude at this point, and then next time we'll talk about alveolar clefts, why we need a dentist and an oral surgeon and an orthodontist to help treat the children with cleft palates, and what the postoperative care is like. We can talk about pharyngoplasty and alveolarplasties, etc. And then we can talk about pharyngoplasty. A pharyngoplasty is a follow-up procedure that we can do to actually improve the speech for these babies. We can actually rearrange muscles and bring some of the muscles of the pharynx back to the palate. I appreciate so much you being here. I'm Dr. David Morwood. I'm a board-certified plastic surgeon, and this is Your Health radio and television program. I hope you'll tune in again. Thank you very much for being here.
Thank you for joining us today on the Your Health radio and television program. We hope that you enjoyed and found today's program informative and helpful in making your life a more healthy one. For copies of today's program, give us a call at 800-477-2149 or check us out on the web at montereyradio.com. Join us next Monday afternoon at 4 o'clock. Until then, take good care. The Your Health radio and television program was created and produced by montereyradio.com.